I'm going to talk to you, interestingly, there will be an overlap, obviously, between what I'm going to be talking about and what Dr. Zakaria just talked about, but, okay, I'm too short, you see. Thank you very much. Okay, can you hear me okay?
Yes.
Back? That's great. Yeah, so the interesting differentiation, if you like, between my talk and Dr. Zakaria's talk is that he introduced the One Health concept. I'll have a couple of slides about that, but I'm mainly going to be focusing on the side of the human resources and why we need human resources, why we need to build human resources, and how we can build human resources, and how we are building human resources under the projects that we're working on. So it's a slightly different perspective, if you like, of the same issue. So just setting the scene, as Dr. Zakaria said, the definitions. There are many different definitions of One Health, and this is a different one here. That I'm starting with health, actually, sorry, to define health, because I think it's very important if we're talking about One Health to understand what health is. And health was defined by the World Health Organization, maybe 50, 60 years ago, as a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's already saying in this definition of health, it's not just about a sickness or a broken leg or something like that. It's the complete holistic view of health, including social well-being. So it's talking about One Health, but not even using the language of One Health. And then, as was mentioned earlier, this tripartite group, FAO, OIE, which is the World Animal Health Organization, and WHO came together to endorse the One Health concept and the One Health approach. And they gave this One Health vision the definition of a transdisciplinary, collaborative approach to improving the health of humans, animals, and the environment. And I want to focus on this transdisciplinary collaborative. These are some of the factors that affect health, or that affect the One Health. Human and veterinary medicine are involved, obviously, when we're thinking about health and One Health and diseases. Epidemiology. Politics was certainly touched upon by the previous speaker. Politics is very important. If you have disease control programs, who endorses those? Who pays for those? Who do you have to convince that you need to spend government money? Politicians. So it's very, very important that government and the experts work closely together and understand each other. The researchers, very, very important, because unless you have researchers, and we're going to be hearing about research in a talk from my colleague in Thailand, unless you have researchers to provide the evidence base for One Health policies and One Health commitment and government commitment, then we're not going to get anywhere. Ecologists, social sciences. We largely forgot about social sciences in the past 150 years of medicine and veterinary medicine. We thought that vets and doctors could do everything. But of course you can't do everything. We don't understand in many ways how people interact with each other. What are the importances of people's interactions, the social aspects of health. And now these are becoming very, very important. The Ebola epidemic hammered home to us how important it was to understand people's cultures, people's beliefs, people's social interactions. It was much more than just a virus. It was a whole social network that caused Ebola, the Ebola outbreak. So we're beginning to understand, and thankfully we're beginning to bring in people like the social sciences and the economics. On the previous talk we saw a lot about economics. Huge costs of rabies, Nipah virus, and HPAI, many, many other diseases. So although in some respects we may think that zoonotic diseases are relatively low impact, you see HPAI, 450 deaths in a large number of years, human deaths, doesn't sound a lot unless you're in the family of one of those people that have died. But the hidden costs of control and that people are doing to reduce those number of deaths is immense, immense, and that's why we need to involve these. So these are all the different groups, if you like, that need to be involved in One Health. And One Health can be applied at any level. You know, it can be applied internationally, regionally, at the national level, the provincial level, the district level, the community level, and of course by academic and professional institutions. So we can apply these One Health principles and work across boundaries at any level. And again, this is the multiple sectors that are involved. 3, in general, the human health sector, the health-related disciplines in the environmental sector, and the agricultural sector, which includes the farmers as well as the veterinarians. These are the groups, if you like, the diverse groups, and it probably doesn't stop there. We often forget public health professionals involve nurses as well, the people that are interacting with the community, people that are getting the messages across to the community. And if we did get an outbreak of a new disease, if there was a new Nipah tomorrow, or somebody came back from the Hajj with MERS-CoV virus, I noticed that they have had one case already in Malaysia last year. But if there wasn't an outbreak of that, who are the groups of people that would be working closely together? And these are just some of the ologists, if you like: physicians, veterinarians, nurses, ecologists, zoologists, entomologists, sociologists, economists, anthropologists, pathologists, microbiologists, epidemiologists, and politicians. The list goes on and on and on of the people that in some way or another will need to interact together. Some more than others, obviously, but they will, at some stage in the disease process, all of those people will be brought in to, and so it's very important to have trained professionals and that they understand each other. And this is what the illustration I always use to my students to show how animal health and human health are integrated, the mythical centaur. And every time I say to students now, what does this mean to you? They all say Harry Potter. You know, so it's a changing face of human behavior. And these are just some examples of some of the One Health problems that we deal with in our day-to-day existence. And all of these are complex problems, or the term wicked problems that I like. It's a nice term. A wicked problem is a problem that just is not simple, very, very complex. And so if you look at these, zoonotic diseases, food safety, very, very complex issues. Public health at the human-animal interface, pollution, cross-species interactions. Pollution, animal pollution from animal industries causes a huge problems to waterways, to disposal of effluent, to disease spread, etc. Wildlife health, human encroachment, antimicrobial resistance, the global health security agenda, which has just been launched last year, and it includes 11 different chapters, if you like, in this agenda. And one of those is dedicated to antimicrobial resistance, which is now thought to be a major, major global issue that is very much a One Health issue. And then disaster preparedness. I was very interested to hear that the National Security Council in Malaysia is the agency that responds to disasters, and they include infectious diseases in their disaster mandate to assist governments in major epidemics of outbreaks of infectious diseases. Very, very good. And this picture we've seen before, but what I'm going to say to you is that investigation and control of these diseases is really impossible without a transdisciplinary approach involving these multiple disciplines that I've just talked about. And so what is transdisciplinary? We have all these different disciplinary words that we use, and people often use them interchangeably. But the definitions are thought to be like this: that multidisciplinary is where several different disciplines are working together collaboratively, as was mentioned previously, but they're working still independently and just sharing information occasionally. Interdisciplinary is more used when we're talking about academic courses, where it's the integration of ideas, and you get different disciplines often working together to teach a shared academic course. Cross-disciplinary is the coordinated effort involving 2 or more disciplines. But transdisciplinary is really thought to be a much more holistic approach. It's, as Dr. Zakaria said, it's when they move towards the truly integrated approach, where people are sitting around a table, sharing ideas, influencing each other, giving a different perspective so that we can try to solve these wicked problems. So not just sitting in different parts of it and sending emails off to each other. It's actually working very closely together, a much more holistic approach. You could almost call it ecosystem health, which is used in other parts of the world. The Canadians like to talk about ecosystem health rather than One Health. I like to think that they're both the same thing, really, and that it's a bit semantics. But we've got to bring the ecosystem in as well. And this is a definition that came out of Lawler et al. American Journal of Public Health, defining transdisciplinary. And I have to read it slowly. I've highlighted the words that I think are very important. So it's an integrated process whereby scholars and practitioners from both academic and non-academic fields, so it's bringing in people from non-academic fields as well, work jointly to develop and use novel, conceptual and methodological approaches that synthesize and extend discipline-specific perspectives, theories, methods, and translational strategies to yield innovative solutions. So it's taking collaboration to the extreme. It's saying we want to take the best of everyone's information and really put it together to get innovative solutions to some of these really complex world problems. And so that's why we talk about transdisciplinary. Of course, people still use the term multidisciplinary, but we need to think transdisciplinarily. Don't worry too much about the word, I can't even say it. So that's the first part of my talk, really, just bringing in the concepts of One Health and into why we need One Health professionals. So from core competencies to outbreak response, now we talk a little bit about the establishment of the Southeast Asia One Health University Network. And so many of the people here might know already about this, and so I apologize that if you've been at these talks before, but I think there are many government colleagues that would really like to understand where the network came from, where my own came from, and what we're trying to do, what our goal and objectives are. So the vision has been mentioned before, this One Health vision. And the One Health approach, that is if you like, the working side of this vision, is encouraging the collaborative efforts of these disciplines working at different parts of the globe, locally, nationally, globally, to attain this optimal health. And optimizing the One Health approach is very, very important, because we need to ensure that each One Health professional, and I'd like to think that we're all considering ourselves as One Health professionals now, are well trained and equipped for their roles for the future to combat emerging diseases. And we need to ensure that professions have the skills to be able to work together. It's not the thing that we traditionally teach at universities. We don't even really often have other disciplines coming and teaching within our universities. Although I suspect if we looked at our academic profiles, we would see that we do have multiple disciplines, but we don't often allow them to express themselves as much as they should. So we need to ensure that professions have these skills, and we need to work together to develop and restructure health systems to benefit from One Health. It's not saying that we need to have a Ministry of One Health, whereas back to the past, if you like, where the veterinary services were under the medical services, perhaps that's not what we're striving for. But we need to make sure that all these multiple disciplines work closely together and share ideas and share information. So One Health and the EPT program then, just a little bit of background. EPT is Emerging Pandemic Threats, the USAID sponsored program that I started with under 2009 to 2014 under the project called Respond. And Respond was the capacity building arm of this program to build capacity for the One Health approach. The goal was to improve the capacity of countries in high-risk areas based initially on avian influenza. USAID sponsored a lot of research and a lot of work in avian influenza control in Indonesia particularly, but also Vietnam and across the region. And they built on this with the EPT program. So they wanted to improve the capacity to respond to outbreaks of emerging zoonotic diseases using a One Health approach, and that was our mandate, was to build capacity. So we were a consortium which included 2 US universities, my university, Tufts University in Boston, and the University of Minnesota, plus some other groups, Training Resources Group. DAI was Development Alternatives Incorporated. They were the money, they controlled the funding and the logistics. And then another group called Ecology and Environment that brought in some ecologists into our picture. We had 2 main regional programs, 2 main aims, if you like. We had to work pre-service and in-service. So at the time we were working pre-service building university networking, building universities' capacity, and in service, we were working with government in-service training and developing courses to train from the One Health perspective rather than in the disciplinaries perspective. The transition came last year after the EPT1 closed. USAID managed to persuade the US Congress to allow them another 5 years of funding to continue the program under EPT2, Emerging Pandemic Threats Program 2. And at this stage, Respond, who I work for, morphed, if you like, or changed into what we call One Health Workforce. And One Health Workforce was concentrating much more, our mandate to concentrate much more on working with universities. The aim of building on the partnerships we started with under Respond through the One Health University networks to address the workforce needs of national ministries and the private sector and the public sector to strengthen the operational capacities of the network as well, so that they're sustainable. We want the university network to work much closer with government and to be sustainable. So why did we establish a One Health network in the first place? Really, it was seen that the strengths of universities could be harnessed to prepare the One Health workforce. Traditionally, governments do a lot of their own training. They train their own veterinary services, they train within the medical services. But this sometimes is not economically very good. There's a lot of other things that governments could be spending their money on than building a training cadre within their environment. And also, the trainers, while they're obviously excellent, they possibly don't have the ability, they have multiple tasks, the ability to respond quickly to other training needs. And we have institutions called universities that are there to train. That's their job, that's their main mandate. Of course they do research as well, but mainly they're there to train young people. And they're to train the future leaders, the future government employees. Most of them come through universities. So why not work much closer together and say to universities, can you change what you do to make the One Health workforce, to build the capacity of the One Health workforce? And we also want to embed this philosophy of One Health and the One Health approach and transdisciplinarity within the young leaders, the young future leaders. So it's vital to establish this spirit of working together at an early career stage. So that's why the USAID decided to work at the university level to start with, to build these sort of these skills within the university students. Maybe not like yourselves, but like the ones that you teach and work with. So this is how the One Health Network started up, and the Dean's meeting of December 2011. A few familiar faces in here, and a few faces that we miss. Prof Baha, we certainly miss very greatly, and these were the group from Malaysia. And we had these 4 countries that we started the university network. The name was chosen by a committee, SEAHUN, the Southeast Asia One Health University Network. And this piece of paper here will probably belong in a museum one day, you know. It's the first time SEAHUN was ever written down, so by Prof Gufron and Prof Li Buang. So hopefully it will be sustainable way into the future. These were the universities in the network. Started off with 10 core universities across the 4 countries, and 2 of those were from Malaysia, with different departments within those. We got a logo. You've seen the logo sort of creeping onto my slides there. We had a logo competition across the region, and this gentleman from the University of Indonesia won it. And he made a wonderful logo that really summed up One Health in Southeast Asia. He brought in all the elements of One Health: animals, the environment, humans, water, and the Southeast Asia region. So we're very proud of that logo. And the vision and mission. The vision was a Southeast Asia One Health University network fostering sustainable, transdisciplinary capacity building to respond to emerging and re-emerging infectious and zoonotic diseases. There was great debate at the time about whether it should just focus on zoonotic diseases, because that was USAID's mandate. But no, people wanted to bring in infectious as well, which I think was very, very important. So it allowed them a bit of flexibility when it came to training and research. And then the mission was to leverage the training, education and research capacities of the universities to build the skills, knowledge and attitude base of One Health future leaders. The objectives to promote and advance the One Health approach, improve the competencies of One Health professionals, build a One Health evidence base through research activity to convince governments and other stakeholders of the value of One Health, and to build cadres of trained professionals to be future leaders. Subsequent to the CIAHUN networks, the universities themselves said that they didn't want to be seen, these 10 universities, as elitists. Why are we the only universities in the region, if you like, in the 4 countries that are involved? So they very rapidly decided that they wanted to establish local One Health university networks like my own. And this was a tremendous step forward. So we went from 10 universities and 14 faculties within the core to approximately 70 or 80 universities across the region now. About 20 to 25 universities are involved in each national network, and multiple faculties now. And many of the meetings we're finding with environmental scientists and social scientists and public health professionals coming into the various meetings, which is great. This is the map of Mayahun. It may be out of date now because every time I put the map up, a new university has joined, which again is great. These are meant to be dynamic organizations. They're not meant to be static organizations. The more people that want to join, the more interesting and it becomes. So you'll see some of your universities in there. If I've missed out some of those universities, don't blame me. Blame Google Maps, maybe. So the initial focus from CIAHUN in the first 5 years, we did many, many things there, but we had a couple of major focuses. We were focused on platform activities that in fact has worked, because we're now taking those platform activities and working with them. And we wanted to develop a set of nationally and regionally relevant One Health core competencies. Competencies are the skills for One Health leaders, and to develop a generic One Health course that could be used by many people that Prof. Rizal mentioned. So what a core competence for CIAHUN, the core competency project. We thought that in order for people to work together, we're talking about One Health all the time, but in order for people to work effectively, it's essential that they have the same set of skills and a common platform, a set of competencies so they can speak the same language across multiple disciplines. So that was the basis for this project. And what are competencies then? Competencies are the knowledge, the skills, and the behaviors that can be measured. That's the most important thing, ladies and gentlemen. They can be measured, whether for a worker or a learner. And core competencies are thought to be the ones that are essential for an organization or a department or any other group. For this project, we identified the competencies locally. So we had workshops. It took a year or more. We went to the 4 different countries, and we had multiple workshops. And we developed sets of competencies in each of the 4 countries. Then we came together and tried to meld them into a set of regional competencies based on institutional and national needs. So just some of the terminology for those of you that are unfamiliar with some of the terms. A core competency is a measurable knowledge, skill, or behavior that every member of a One Health team should have, or must have. And then we group the competencies into domains. Domains are just groups of competencies in a logical category, and I'll show you those in a minute. And there are technical competencies that I won't dwell on too much at the moment, but please remember that all of the One Health people that are coming in, as well as the One Health core competencies that are different, they have technical competencies. We have people with microbiology skills, diagnostic skills, epidemiological skills, and many different skills depending on their backgrounds. These are what we call the technical competencies that we expect the different members of a team to have, because they've done their academic training on these, and sometimes they've done postgraduate training. So we didn't focus so much on those. And an example of a competency then, if you think of taking it back to the skill or the behavior. The skill or the behavior, you want someone to be a good communicator. So the competency is the ability to create an effective message, and you can measure that. The measurement is the ability of the target audience to correctly restate the message in their own words. That means they've got the message, they've been well communicated to. And then we have the domain is communication. So multiple competencies under one domain. So What are One Health core competencies? How do they differ from general competencies? Every discipline has their own set of competencies. One Health core competencies are the ones that are essential for an effective One Health approach and related to outbreak response, disease detection, disease surveillance, and disease control. And we call these One Health core competencies. And they can be used in many different ways. But with our academic partners, we looked at using the core competencies to be used in a specific course. So the competencies can be used to derive, we can use them to make learning objectives and to use them to train our students. And the competency domains are the much bigger picture. These are the groups of competencies. They're used in curriculum planning, course planning, new courses, new course developments. So they're not we don't make our learning objectives from domains, we make them from the more specific competencies. So in curriculum development, often we work with the domains in order to address these larger areas, if you like. And I'll show you the domains we came up with in a minute. So the group came up with 7 core competency categories were identified, for which number of competencies were developed underneath those. And these were based on consensus of many, many people. In fact, people around this room were part of the process. And this is what we came up with. Malaysia came up with their own group of what they thought were the regional competency domains that they came up with. And it was remarkable. We worked independently. Although there was there were people from the US universities facilitating we didn't take ideas from one country and tell another country what to do. We listened and tried to get them to come up with it by themselves. And so it was remarkably consistent across the 4 countries. And these were the groups that Malaysia came up with. When we got together in October 2012, we got all the groups together and we said, right, we've all got these 4 different country level domains. How about we try and come up with some regional ones for Southeast Asia? And this is what they came up with. These were the 7 domains, competency domains. Whoops. Management, communication and informatics, culture and beliefs, leadership, collaboration and partnership, values and ethics, and systems thinking. And when I presented this at a conference recently in Thailand, my colleagues from the senior gentleman from the Ministry of Public Health that deals with the Field Epidemiology Training Program, FETP, said, these are very, very important skills, but we don't teach them. We teach epidemiology, we teach the technical skills. And he's very importantly, very interested in teaching people to be good leaders, to be good collaborators, to understand different cultures and beliefs. And I alluded to that with the Ebola virus problem. So these are some people call them the soft skills. I actually think they're much harder skills than technical skills because they're very, very hard to teach. How do you teach these things? This is what we tried to get down to. And these are just a bit of a big slide. I tried to break it down, but I tried to get it in one of these where the bits flashed in, but for some reason the table just vanished and came up in one. But anyway, these are just examples. You get a copy of this talk, hopefully through Eddie, so don't worry about it. But these are the definitions that we used for these competency domains. Because as well as coming up with the domains, we came up with definitions, it was a huge process. So we take management, the ability to plan, implement, monitor, and evaluate One Health programs to maximize effectiveness of One Health actions and desired outcomes. Leadership, the ability to initiate a shared transdisciplinary vision and to motivate and inspire teams across sectors. Good leaders are not, don't just grow on trees. They have to be made. You have to make people good leaders. Some people are instinctively good leaders, but many other people can be good leaders if they're trained correctly. And in fact, there was something I came up in the paper on the plane across here. It was there's all these management groups that are doing training for various organizations, and a lot of them are training in leadership and how to be good leaders. This is the 2 that I think are very important are culture and beliefs. The ability to understand, analyze, and appreciate social, religious, and historical diversity across different cultures with individuals and societies. And the Nipah virus in Malaysia taught that. You have a Muslim group and a non-Muslim group. And non-Muslims don't eat pigs, and non-Muslims eat pigs. but they had to come together to work together to discuss ideas because of a virus outbreak that actually affected multiple people in society. It wasn't limited to one particular group. So these groups had to understand each other and understand each other's perspectives. And so Nipah virus really, a virus and a disease doesn't respect cultural or specific or religious boundaries. So we have to break those barriers down and be able to understand people's beliefs and how they relate to One Health. Similarly with gender issues. USAID is putting a huge focus on gender issues, gender and health, because we're finding that there's great discrepancies between men and women in health aspects. And I'm not just talking about women get diseases of pregnancy and men don't. That's a bit simplistic. But in many parts of the world, women, particularly at the rural and community level, do things that the men don't, that put them at greater risk of infectious diseases. And this is coming about through things like HPAI and diseases like Ebola virus. So we have to understand all these perspectives. And the other one that I would ask you just to take note of is systems thinking. And this comes back to the wicked problems I talked about earlier. And this skill is the ability to analyze how various elements influence and interact with one another within a global perspective that results from the dynamic interdependencies among human, animal, environmental, and ecological systems. Many of those One Health issues I talked about are incredibly complex. And as I say, we'll hear about a very complex issue from my colleague from Thailand that's being looked at through multiple agencies. So systems thinking is a very important skill. This is just an example showing that leadership is a strategy. These are some of the competencies within the leadership domain. Strategy development of clear scopes of work, roles and responsibilities, ability to be a team leader and a team member, conflict resolution, ability to achieve compromise, problem-solving skills. These are all the skills that a good leader has. So we see these as the competencies that you can measure. You can put in place measurable outcomes for these. Collaboration, the ability to work across sectors and disciplines, understanding of systems and needs, opportunities and challenges, ability to interact with others and to find common ground, networking, relationship building. These are skills that we can measure. And these are just some of the competencies under those domains. Again, I won't go into all of those, but taking systems thinking as an example, the ability to think outside the square and to identify the many factors associated with the disease occurrence. You can set in place training for that, and you can measure it. And the other one I like, cultural beliefs, the ability to generate trust among the community within a One Health program. You're going to a group that have their own beliefs and their own way that they interact with themselves and animals, and you're trying to put different government perspectives on them. You have to understand where they're coming from, and they have to understand where you're coming from. So what can we use the One Health competencies for? As I said, we're using them. Universities are now working with stakeholders from government, like we're doing today, to identify gaps in curriculum and to say, what do you need us to put into our curriculum? We can change, we can be dynamic. Universities often aren't very dynamic. They're often old, they often drag their heels, they take a long time to change. But we have to change that from within. We have to be able to be flexible, develop new courses for governments as needs occur. Ebola virus, be able to respond to that and say, right, we can develop a new course on Ebola prevention, on Ebola control, on Ebola sort of surveillance. And we can only do that by providing the new graduate species, if you like. So that's what we're using these competencies for. And we've worked across with our university partners to look at their courses and to map their curriculum. And then to develop learning objectives and based on those knowledge, skills and behaviors, so that the courses that they're developing are actually truly measurable courses, that they can measure the students' abilities and skills and say, right, we are producing good One Health leaders. These are just some of the competencies that we thought should be integrated, some of the learning competencies and learning objectives. Again, taking this communication and informatics. The competency is apply various communication media approaches. The learning objective is contribute to the design of PowerPoint, video, photographic and other media approaches to team presentations. So from the competency, we develop learning objectives. So I won't go into all of this. As I say, you're used to doing learning objectives, many of you through universities anyway. But it was just to show you the process that we went through, and we're still going through. We're still working with the universities. So next step of what we did was to develop a set of regionally relevant One Health training modules. And again, this was a consensus approach. We worked with many of the people from the competency development teams. We got together in the countries. We got a regional team of about 30 people, and we said, right, what are the competencies needed for One Health professionals? What are the modules that we need to make a course? Initially we called it the One Health short course, but it started getting longer and longer, and this was one of the members of the course from UKM, Sham, and he was a very active member of the course. We held workshops in each country. We developed the module material, and we tried to develop innovative teaching methods, such as things like many of you have had this marshmallow challenge that we use for showing a collaboration and partnership, getting people working together. And that's been very successfully used at many different workshops. So we got these innovative ways. This is just one of them. We tried for all the modules to get different ways that we could get the material across to students. So just obviously the traditional didactic lecture was as it's used. We can't deny that. But we thought of other things: field-based programs, problem-based learning, skill-based learning, etc. And we had a lot of fun in the process. A range of different activities were covered in the program. We developed, as I say, with each of the modules, we developed many different ways in which we could get the modular material across. And we finally came up, we built on those regional core competency domains, we came up with a set of 15 modules. I have to be honest, we came up with a set of 14 out of 15 modules. One module was not completed, basically because we didn't have the appropriate skills at the time, and that was One Health Economics. And that's a gap that we need to fill at the moment. That's the only module that remains incomplete. But all of these modules, including, as I say, you can see the core competency domains: systems thinking, collaboration and partnership, culture, beliefs, values and ethics, we put into one module and designed it as a module. And the idea with these modules was that they can be used in any particular way or fashion. You can mix and match any of them. You can make them into a one-day course. Our colleagues at Mahidol tried to do One Health one-day course. Or you can do a 3-month course or a 2-year course. You can make them into anything you want. It's not to say that these have to be used in any particular way. The other thing is that they're freely available to anyone in our membership. There's a website that you can go to. I meant to put it up here and I've just forgotten it exactly. I think it's Siahun One Health Modules. It's a WordPress. And you can go there and you can find all the materials: trainers' guides, students' guides, PowerPoints, and teaching materials. So Eddie has that. All the national network offices have access to that. You don't need a password or anything. You can just get in there and have a look for yourself. And you can take, if you want the material, you can use it in any way you want. And how do you develop a One Health course? Well, you have to know your competencies, review your curriculum, identify the gaps in your curriculum where you'd like to add some One Health material, some One Health competency material, and then you could design a new course if your colleagues or other stakeholders want you to design a 1-week course for them that you could help for in-service training needs, as we're doing in many countries at the moment. We're going to Vietnam next week to develop an in-service training course for government ministries with the universities, and then use the course materials to fill the gaps. Just a little illustration using a jigsaw. So in conclusion then, we feel that so far it's been a highly successful collaborative network of related One Health faculties has been established in Southeast Asia. And we feel that this will go from strength to strength. The more of you that are involved, the more that our government colleagues want to interact with you and want to work closely with you, And as I say, it varies from country to country. You know, in Malaysia, you probably have very good interactions with government. In other countries, it's starting to build up at the moment. So it can get better, it can get stronger. And network members from multiple disciplines have worked closely together, very closely together, to define the required competencies for One Health professionals, to develop training materials to be used for revision of courses and to develop new ones, both for pre-service and in-service training. And universities have initiated dialogue with governments on the makeup of the future One Health workforce, and that's where we're going with EPT2. And we need to build on this and strengthen this during the next 5 years. That's why our project is called One Health Workforce, to build the One Health workforce, but it's to build it with government and other stakeholders. We build it, universities build it, but we need the input from them as to what they want. So the chair of Siahun was successfully handed over from Indonesia to Prof Hasim in Malaysia in December 2013, and in December 2015, the third iteration, Malaysia will hand over to Thailand. They decided to go alphabetically, so Vietnam gets it in 2 years' time. So Prof Gufron, who incidentally, Prof Gufron is very interesting. He started off as the Dean of the Faculty of Medicine at Gajah Mada University, and then he was headhunted by the government, and he became, a couple of years, he was the Vice Minister of Health. So we had a really great friend in court from Siahun, who was a very active member of Siahun, and the chairman was also the Vice Minister of Health. And he went back to the university, but he's now been headhunted again, and he's the Director General of Education Services for government. So he's in a very, very influential position, and still a very good friend of Siahun. So what is One Health? One Health, to me, is very much just working together. Keep it simple. Don't make it too complicated. And thank you very much. Our world, our health.